Hello, it's Tuesday, September 7th, 2021. It's World Duchenne Awareness Day, and you are now officially part of our live online interactive talk show about adult life and Duchenne. My name is Gerrit Heikop, and I have the honor to be your host and guide throughout our exciting program today. And I hope you're actually wearing a touch of red. Like me, myself, I'm wearing my red sneakers like I always am, but today they feel extra special for me. And around the globe, people have been lighting up iconic buildings. For example, here in Turkey, just an example of the big bridge, but there's many more buildings in Turkey lit up in red. Furthermore, we saw in Spain, the Sagrada Familia in Barcelona, in Madrid, San Juan, the famous mills, all in red. Then in Vancouver, we got photos of BC Place, the famous stadium that is also lit up in red. And we got photos from all across the globe, maybe even in your town. We saw the Petrin Tower in Prague. We saw municipality buildings in Chile, Santiago, Chile, in Canada lit up. And last night here in our own Amsterdam, where our World Duchenne Awareness Day studios are, we have the famous Museum Square with the brand and the theme of today's World Duchenne Awareness Day. Well, if you've been part of the Duchenne community before, you know that this is a very special day where we try to raise as much awareness for the Duchenne muscular dystrophy as possible. And each year we create this video that really should touch people's heart and should really make them aware of how important it is to spread the word. And to kick off this live 2-hour talk show, we'd like to launch the official video of this year for World Duchenne Awareness Day 2021. Yes, beautiful, powerful message. Words are important. Let's spread the word. And that's exactly what we hope we do today and that you become a part of. And if you're active on social media, for example, on Instagram, on Facebook or on Twitter, please make use of the hashtag of the World Duchenne Awareness Day 2021. Hashtag WDAD 2021. And we would love to see you sharing your photos of your touch of red, of how and where you're watching this live online broadcast, and perhaps any insights or takeaways that you take away from the next 2 hours. In a minute, I'll tell you everything that you can expect from this interactive broadcast. But first, I'd like to kick off with the chair of the World Duchenne Organization, Elisabeth Vroom. Elisabeth, good afternoon.
Good afternoon.
Let's kick off with the basic, the theme of today, adult life and Duchenne. Why is that the theme of this year's World Duchenne Awareness Day?
Well, because I think we have for decades been working to have a better life expectancy of boys and sometimes girls with Duchenne. But then when they enter this adult life, they should have a good life and they should be able to get the maximum out of that. So there's a lot of good intention. We've been speaking about that for a long time, but now is the moment to act. So not only spread the word, but also take action on adult life and Duchenne and how to improve this.
Exactly. So it's actually a very hopeful day, life expectancy raising and now coming into new challenges. I'll ask you in a little bit about some of these new challenges and opportunities, but let me introduce you to our exciting program that we have ahead of us. In a little bit, we'll talk about first the medical perspective, because we might need new standards of care when we talk about adults with Duchenne. And for that, we have Professor Ros Quinlivan with us today from the UK. Ros, good afternoon.
Hello, nice.
Thank you for being with us. Secondly, we'll talk with Nicoletta Madia about her learnings from the Social Duchenne project. You interviewed many adults with Duchenne and kind of tried to show what it's like to live with Duchenne as an adult, and we'll learn from your lessons about that. We'll zoom in on the psychosocial aspects of living with Duchenne and discover what it's like to dance with adulthood in Duchenne, together with Jos Hendriksen. Jos, welcome. Good afternoon.
Thank you.
And in the last part of the program, we'll learn a little bit more about how we can contribute, what we can actually do ourselves, and how we can become part of a global movement together with Lawulani Makabela from Rare Disease International. Lawulani, good afternoon to you as well. We are live, it's interactive, so in the last part of this broadcast, we want to answer as many of your questions as you can. So if you're just joining us, at the bottom of the screen, you see a button Q&A. If anywhere during the program you have a question, please submit it there. Or if you don't have any questions yourself, scroll through the questions that others have submitted and provide your thumbs up to the questions that you would like to see answered as well, because then we kind of know what to select in that last part of the program. And last but not least, throughout the next 2 hours, you see these beautiful interviews that Nicoletta has made with adult men living with Duchenne muscular dystrophy, and they share with us their experience, their view on life of what it's like. So very inspirational, entertaining, and educational 2 hours coming up, and we're very glad that you are currently part of that. Elizabeth, we already mentioned, it's a hopeful day. Let's start to talk and let's dive deeper into adult life. But can you elaborate a little bit on the new opportunities and challenges that come with this new phase?
Yes, well, one of them is, as we will hear, the medical thing. It's not that an adult with Duchenne is kind of a copy of what is needed for the children. There are different issues, we will hear that later, organization of care. But it's not only health. If we speak to the older boys and men, their biggest challenges are not their health problems, but how they can participate in society, have a job, have relationship, becoming a father, getting the maximum out of their lives. And a lot of people are not ready for that. So society, their own environment sometimes, maybe sometimes even their parents who get older now, have to get used to look at life in a different perspective. So I think there are a lot of challenges. Yeah.
A lot of challenges. Now, in the promo of this talk show today, we mentioned both opportunities and challenges. What are some of the opportunities that we're facing now?
Well, I think the biggest opportunity is that the field is capable of having a lot of boys living into adulthood. I think that is amazing. And we always have to mention that there are still boys dying at a younger age. And that's, for these parents, it's still hard to hear us speak today about adult life and Duchenne, because we know not everybody will reach it. But we see that many more are reaching this age, but also in a better condition, in better shape. So they are capable of doing more than they could do before.
Exactly. Exciting times ahead of us. Now, finally, and I'll ask you this again at the end of this show as well, but what do you hope at the outlook of these 2 hours, what do you hope our viewers take away from this today?
That we all have a role to play here. The men themselves as well, by having expectations about their own life and trying to reach the stars. The families by trying to grow, raise as a normal child, let's say, so give them as many opportunities as they have. The medical field really also have to look more into the new aspects of the care, but also how to organize the care. And then last but not least, society has to be more accessible, give them opportunities to work and so on.
Exactly. So there's a task for all of us to take action. That's why it's so important. That's why we talk about this topic today at World Duchenne Awareness Day. I see already quite some questions dropping in. So thank you, Annemiek, Atsma, Russ, and some of the other questions that just dropped in. This is how it works. I see it right here live on my desk, and we take as many questions as we can at the end of the broadcast. Thank you, Elizabeth, for kicking us off and getting us on track on this theme. And as I mentioned in our kind of overview of the content today, we will hear from the men themselves. Nicoletta, part of your project, you've gone out to interview many of these different men, and we'll hear from 4 of them throughout the broadcast about their life, their experience, and what it's like to become an adult with Duchenne muscular dystrophy. And the first one we hear from is already 39 years old, living in Israel, and it's Aylon Golan.
My name is Aylon Golan. I am 39 years old. I live in Israel. After I finished my high school, I studied a vocational study of it's called sound engineering, and I finished my studies with distinction. And I worked in this field for a few years, the field of recording live performances, studio work, film work, everything to do with sound. And because my disability became, as you might know, in Duchenne, it becomes worse with time. I couldn't work in that field anymore, and I stopped working as a sound engineer. And today, mostly my time is spent either speaking with people with disability in our local organization, which is called Little Steps, which is the organization for Duchenne in Israel. So I try to share my experiences in life with families and people. Other than that, I also lecture about disability and my outlook in life in general, and how to be optimistic in spite of difficulties and challenges in life. I try to bring a bit of optimism of what is possible with the disability, which basically means that you can study and you can have fun and have a great social life and everything, despite having a quite severe disability. And the new families don't necessarily know that right at the beginning. And to give them a bit of optimism that it's not the end of the world having Duchenne. So there were moments in my life where I had to deal with the fact that I will not be like everybody else, and that was not easy. But on the other hand, having my disability and needing to overcome all those challenges made me a stronger person and helped me to be empathetic to other people and their challenges, and to see the perspective of other people's challenges. And I think that coping made me a stronger person.
Yes, beautiful story, and we'll hear more of this story. Thank you very much, Aylan Golan, for sharing your story and actually your active work and spreading this message of hope. And Nicolette, congratulations on this first interview. Now, I see that we have started. We are super live. I just saw on Twitter that we are now joined by Zoe Davidson live with us from Australia. This is truly a global audience. I see the first questions coming in from Martina, Sarada. And so if you don't have a question yourself, please promote the question of someone else. We will take as many questions as we can at the end of this 2-hour broadcast. Let's dive into our first topic of today, the medical standards of care and the developments that we need in that area. And to join us joining us today to talk about that is Professor Ros Quinlivan. Ros, good afternoon.
Hello. Hi.
Let me start with you, Elizabeth, because Ros is officially Professor of Neuromuscular Disease at the UCL Queen Square Institute of Neurology in London, joining us live from the UK. But who is she and why is she important for patients with Duchenne muscular dystrophy?
Well, I think because she was one of the first who was really paying a lot of attention to the specific care for Duchenne, not only on the topic, but also on how to organize the care. I remember we visited 10 years ago, and you already had this ward, how you could better look at the man with Duchenne and serve them better. And I think at this moment, it's amazing that you are the one who took the lead, and I'm sure it has been a lot of work to put all the expert opinions together, how to best care for adults with Duchenne at this moment. There's not a lot of evidence, I'm sure you will tell that, but at least starting from what there is there and the expert opinion, you did an amazing job, and it will support patients around the globe, and that is what we will spread after this meeting. This information will go around the globe, and we hope a lot of patients will benefit from that.
Beautiful. So actually one of the real pathfinders in this area for adults with Duchenne. Glad to have you with us, Ros.
Thank you. And thank you very much, Elizabeth, for inviting me and for that lovely introduction as well. And it's a real pleasure to be here because it's a very special day today.
It's a very special day. Let's zoom in a little bit on the medical perspective. We mentioned the word standards of care. What do we need to understand about these? What are these and what is happening with them?
Well, you know, the first international standards of care for Duchenne were published in 2010. Kate Bushby was the lead author. And that really paved the way for improving medical care for children and adolescents with Duchenne. And those standards of care were actually updated in 2018. And they're very comprehensive documents. They put the patient at the centre and they really emphasise the importance of coordinating really complex multidisciplinary care. And this has, I think, really led to an improvement in the health of young people with Duchenne. And so since I've been working with adults, what we're seeing are growing numbers now of adults joining our service. And actually, the resources in healthcare haven't matched that, actually. So, you know, that's why I think there's a need to look at adult care specifically now, as these people have very different needs, I think, to the children.
Yeah, can you elaborate a little bit on that? Why do we need have some extra considerations when we look at adults with Duchenne?
Yeah, well, I think there are a number of different reasons why we need to think about adults differently. Firstly, in children, we're looking at prevention or delaying the onset of complications. In adults, we may need to actually start treatment to manage these complications that have arisen. And also, we've got very different patient populations now. We have people who've never had steroids, and some of those people are getting quite old now, into their 40s, and developing other health conditions that they that are unrelated to Duchenne. And that in itself poses difficulties for us as doctors. But also we have now these healthier patients who've been treated with steroids who are coming through to the adult service. And I think our adults with Duchenne are meeting new specialists that they wouldn't have met before. They're meeting gastroenterologists and renal specialists. And sometimes they need surgery, and sometimes they need general anaesthetics. And so and that's just to name a few. So many different areas that are posing problems that I think we need to add to the standards of care that we already have.
Exactly. So new medical specialties come across these patients. And you referred to the use of steroids several times. Help me understand, why is it so important that these other medical professionals are also aware that these patients are using or not using steroids?
Well, there are a number of reasons. In my experience, a lot of adult neurologists want to stop steroids when patients come through to the adult service. And in fact, actually, steroids, we know, really benefit boys with Duchenne, but they also have a lot of side effects. So we have to manage those side effects. And we have to manage those side effects proactively to try and prevent things from happening, such as fractures, for example.
Exactly. So you're saying if you come into the adult healthcare system, a neurologist might quickly say, oh, steroids, get off that. And they might not be aware of the beneficial effects for these specific patient groups.
Absolutely. And also, if the care is not coordinated, then people might not think about steroid treatment. So, for example, if a man goes to his local hospital and has to have surgery, for example, they might not think that you need to give it extra doses of steroids around that time.
Exactly. Another reason to really raise the awareness for this disease and these standards of care. Now, you've been working on the Adult North Star Network in the UK. What is that exactly, and what can we learn from it?
Yeah, so, well, firstly, I must say that we're very grateful to Muscular Dystrophy UK for funding this network. So we established this in 2015, and it's a network of clinicians, so physicians from all sorts of specialist backgrounds, neurologists, respiratory physicians, cardiologists, we have a renal physician, we have gastroenterologists, and also all the therapists that are involved in managing patients with Duchenne. And we got together because we felt that there was a need to better resource our services. And in order to do that, we have to standardise care, because our health providers are not going to provide us with funding unless we can develop guidelines, and say everybody has to have the same standard of care wherever they live. Because actually in the UK, there was quite what we call a postcode lottery. So depending on where you lived, you got a different level of care. And we also think this is really, really important as a start, because there's so little evidence for some of the guidelines that we're putting forward. They're based on expert opinion. So we've also developed a long-term natural history database where we're going to collect data, and hopefully that will give us a platform for research to improve our outcomes even more.
Exactly. So it's very important to standardize both on the financial side, but also the research side. Absolutely. And the quality of care across the country. Absolutely. So this is really advancing work. Can you share with us a little bit what this guidance that then comes out of that, what that means, and some of the things you found already?
Yeah, sure. So I think it's important that I emphasise that this guidance is not to replace the established standards of care, but it's to add to those standards of care. And so we've gone through various topics, including respiratory medicine, anaesthetics, cardiology, nutrition and bowel management, renal disease, bone and endocrine, and what I call the 3 Ps, psychosocial, participation and palliative care. Mm-hmm. And we've also developed some therapy guidelines, and these are currently going through peer review at the moment.
Exactly. So to my understanding, all these different topics you've looked at, you've referred up through a thorough process with colleagues and other doctors and scientists, and said, okay, how is an adult patient different, or where do we need to pay attention?
Absolutely. And we've all worked together to agree on what we think is the best practice.
Can you share some findings? Let's go through the topics so we can learn and take notes. Please take notes if you're...
I'm really going to briefly go through some of the things. I mean, we're very fortunate in the sense that in the UK, respiratory care is very well organised. So we have ventilation centres. And so actually all of the ventilation specialists got together to produce some very comprehensive guidance on respiratory care. And they also talk about secretion management and drugs that you might use if too much saliva is a problem. We also talk about other ways of improving cough. So everybody's heard of a cough assist device, but also we would use, for example, in the early stages, what we call a lung volume recruitment bag, or an LVR bag, which is easier for patients to use and carry around. And we also talk about intensive care management as well. And then we have a section, again, of quite a detailed section on anaesthesia, because it's a big problem for our patients. What we find is, I sometimes get a call that so-and-so is at a local hospital and they're planning to do a general anaesthetic next week, when that local hospital doesn't have an intensive care unit, when they haven't asked for a cardiology opinion or a respiratory opinion beforehand, and they haven't done a proper pre-assessment of the patient. Because, anaesthesia is complex in people with Duchenne, and it has to be done very, very carefully. But also you need to look at the alternatives. For example, is it easier to use a regional anaesthetic, a local anaesthetic, instead of a general anaesthetic? So lots of things to consider with anaesthesia, and also there's quite a lot of detail about the drugs to use as well. And we talk also about cardiac care, and again we have a network of cardiologists. There was a survey published in 2015, the CARE NMD survey, which was a survey of adults with Duchenne across the UK and other European countries. And certainly in the United Kingdom, a lot of adults with Duchenne were not attending for their regular heart or respiratory checkups. So it's really important we bring people back into the clinic. We also are still seeing adults who were grown up by the time the standards of care came out, and they haven't yet even started cardiac medications. So they need, the cardiologists need to be aware to start these medications if they haven't already started them. And I can't emphasise enough as well that optimising the ventilation is really good for the heart. So we have a number of our patients who are worried about using their non-invasive ventilation, but it's good for your heart as well as your lungs. And finally, many of our adult patients now need further treatment, more than ACE inhibitors, more than beta blockers, to help with heart rhythm and to help with heart function. So it's a bit more complex than the pediatric standards.
Exactly. So we can already learn from these first three topics: respiratory, anesthetics, cardiology. You say things are more complex. The regular specialists are not aware of the potential risks and difficulties. So really start to understand why it's important that this knowledge gets spread. Let's take a few more. The next topic.
So now the next few topics are ones really where there's not a lot of evidence in terms of a research background. But these are problems that occur specifically in adults, and they're less likely to occur in children. And, you know, what we're seeing is kidney stones and bladder symptoms in our adults with Duchenne. And also we're seeing people who don't drink enough fluid, and that in itself can cause problems. It can cause constipation, but also can cause kidney injury if you're taking heart medications. So we need to have some really clear advice about fluid intake. And about blood pressure monitoring. So if you're on steroids, it can be high, but if you're on heart medications, it can be low. So we have to find the right balance of the blood pressure. And we also, in our unit, regularly, once a year, monitor kidney function in patients. I think, you know, we don't do that regularly in children because there's not a need to. So I think the monitoring needs to be more frequent in adult patients. But, you know, this is all expert opinion because there's very little research. We need more research into what's going on with the kidneys and the bladder in our adults with Duchenne.
So if you say it's not very research-based yet, what made you decide to actually increase the monitoring?
Well, because we are seeing patients who develop acute kidney injury.
Exactly.
And, you know, we want to try and prevent that, again, moving into the prevention stage, but also what to do when it does happen. And I think the more we can collect information about what the best management for these patients, the more we learn, the more we see, the more we learn. So it's really important.
Important work. Thanks for sharing. We have a few more of the topics you mentioned.
Absolutely.
Yes.
So nutrition and bowel. I think this is a big area in adults with Duchenne, much more important, I think, than in pediatric age range. I think it's really important that adults have their weight monitored, and that's quite tricky if you're a wheelchair user. You've got to have special scales, wheelchair scales, and it's got to be done in the clinic on a regular basis. And what we find actually is with adults, there's more of a tendency to lose weight. So we've got to make sure that the weight is maintained and that people don't become malnourished. We need to you know, the other problem that adults have is abdominal bloating, and that can be a really significant problem. And we don't really know how best to manage that. But again, we've put some ideas down on paper, and again, more research is needed to improve this area because it's a big, important area for our adults. And then moving on to endocrine and bone, well, we've just used the standards of care that are already out there because the same applies to our adult patients, preventing fractures in patients who are on steroids, emergency plans for steroid patients if they're unwell or going to have surgery. And actually really important for our men is testosterone, you know, and making sure they've got enough of it and that they go through puberty properly. And then finally, we recommend monitoring blood glucose on a regular basis. We also, there's a new kind of problem that's recently emerged, which is acidosis in adults with Duchenne. So it's about how to manage that so that when they do present to hospital, people know what it is and how to manage that.
Mm-hmm. And again, that brings us back to today, right? Yeah. And if you're just joining us, let's spread the word. That's the key message of today, not only to all the people around the world for fundraising, but also to all these medical professionals locally, regionally, everywhere where we are. Very important.
Absolutely. Yes. And then the last
the
topic,
3 Ps.
The 3 Ps. And I should say last but not least, perhaps the most important, participation, psychosocial health and palliative care. And, you know, we really need to improve our transition planning. You know, it's really important that young people have a voice so that they can learn to express themselves. Peer support is really important. and actually providing seamless care between the adult and paediatric services. And really there should be joint clinics, not one joint clinic, but joint clinics where they start to get to know the teams. And the other thing we find in our adult population is access to a full range of therapy services is much more limited due to resource issues. So this is just as important for adults as it is in children. And so we really emphasize this in our document. And finally, while we're still on psychosocial and palliative care, we feel that it's really important that there's a clinical psychologist embedded in the service, together with a link with palliative care to help with other symptoms, pain, fatigue, and anxiety and depression, which we see quite commonly in our adult population. And also support for the patients and also for their families as well. I think that's a really important aspect of care.
So that really rounds up our program today as well, with our own clinical psychologist at the table, Jos Hendriksen, which we talk to later. So in conclusion, what is the important thing that you would like people to take away from this list? There's a lot of work to be done and a lot of insights. Just in 10 minutes, you already list of all these things that we need to take into account.
Absolutely. I think there needs to be better coordination of adult care. Adult care needs to be better resourced. There needs to be much better communication and liaison between the different adult specialists involved in the care of the patient. And also there needs to be better liaison between the centres. I think all adults with Duchenne should be managed in a specialist centre, but that centre needs to liaise much more closely with the local hospital as well. And as we've already said, we need more evidence-based research, and I think that's something that we're crying out for at the moment.
Well, you're not the only one, if I may. We are live. I see your Q&As coming in here live on my desk. And there's many questions, but there's also people promoting questions with a thumbs up. And the current question with the most thumbs up is from Christopher Castellini, who actually says, so what are the clinical trials and research projects for adults with Duchenne? Are you aware of them, or is there a list somewhere, an overview? Where are we?
Well, there are very few clinical trials, but in fact, there have been some. So we had the Sideris trial for Adebenone. That was the very first trial for adults with Duchenne, which finished about a year ago. We have another trial just about to start with a company called Fibrogen. So there are trials now starting, but the vast majority of clinical trials are still in the pediatric age range.
Exactly.
But I think we need to develop research into, how best to treat bowel problems.
Yeah, because what you share with us here today is much broader than just a trial on medication. It's about the standards of care. But I guess these also need to be researched, right?
Absolutely. What's the best drug to help with the bowel? What's the best drug to help with blood pressure or kidneys or whatever? So we really need to understand what's the best practice.
Exactly. Well, thank you for your question, Christopher. Now, Ros, finally, I understand somewhere in the next few hours an important paper is being published. What can we expect and where can we find it?
So we have published this guidance in the Journal of Neuromuscular Disorders, and I'm really delighted that they accepted our publication, and it's going to go live online later today, I understand.
Exactly. It's a fitting date, right? The World Duchenne Awareness Day. And in this paper we find more elaborate work on what you've just published in the highlights here.
Absolutely. So what I've shown here is just the highlight. And what we're hoping to do also, or what we're planning to do, is also to develop a patient-friendly version of this as well. So it'll be easier for people to understand and to carry around with them so they can wave it at their doctors and say, this is what I need.
As soon as you come across a medical professional, you say, here's Ros Quinn-Liven's work. Elizabeth, when you listen to this, what are your first reflections? Obviously, you and the World Duchenne Organization will heavily promote and work with the paper coming out today.
Yes, sure. As soon as neuromuscular diseases will put it online, we will spread it through social media. What we have learned is, as long as something is not published, it's for patients very hard also to make their point in the clinic. If you go to a clinician and something is not published, then it's really hard to,
I have heard on the internet that.
And patients, adult patients, and sometimes their parents, but also adult patients, they sometimes know a lot, often know a lot. So it's really fantastic that this paper will be there, and we will encourage, and we can speak about it later, also patient organizations to kind of plug it in their countries. So their clinicians working with Duchenne patients will at least have this as a starting point. And then from there, everywhere we will encourage people to kind of join and add more information by the time they have done proper research.
Exactly.
And also the patient-friendly. And we have to, again, thank Muscular Dystrophy UK here, not only for this version, but also because they took the initiative to have the patient-friendly version. And together with them, we will translate in as many languages as possible. So parents in other countries can also have access to the lay version, and they again can spread it to their families. So,
Exactly.
but this is really what we were waiting for, not only for a reimbursement, but also for a patient just to get certain services done, a certain medication done.
So very important work.
Yes.
Thank you for being with us today, Professor Ros Quinn-Liven. And you stay with us for the full 2 hours ahead, because if you have any questions, please submit it via the Q&A box. At the last 20 minutes of this show, we try to answer as many questions as we can, and we kind of guide ourselves based on the thumbs up that questions get. So if you don't have a question yourself, please influence what's going on here at the desk by providing the thumbs up. And please help spread the word. We do that today with hashtag WDAD2021 on Twitter, on Instagram, on Facebook, anywhere. Make everyone around you aware that it's World Duchenne Awareness Day today and that there's important work to be done. There's news coming out, new standards of care, new research needed, and we are live today for at least 1.5 hours more. So if you know anybody who finds this interesting, share a photo of yourself participating here, share it and let them join the party as well. Next step on our journey is another of these wonderful stories that Nicoletta Madia has made as part of the Social Duchenne project, where she interviewed adult men with Duchenne about their life, what it's like, and their view on life. Now, the next one we're going to see is going to bring us to Italy, actually to a very young adult, a very passionate young man, Jacopo Verardo, who will share with us his view on his current life.
Sono Jacopo Verardo, ho 18 anni, vengo da Cordenons in provincia di Pordenone e frequento il liceo delle scienze umane, sono al 5º anno. Io sono appassionato di motori, mi piace tutto ciò che ha delle ruote. Ho la passione per il giornalismo sportivo, infatti mi piacerebbe in futuro diventare giornalista. Gioco a wheelchair hockey con i Friuli Falcons è uno sport fantastico che ti dà un sacco di emozioni e quindi ho una vita abbastanza attiva, ecco. Mi piace innanzitutto l'ambiente che sta intorno, perché rispetto ad altri sport, per esempio il calcio, qui c'è più, sarà perché è anche uno sport praticato da ragazzi con disabilità, ma è un ambiente più amichevole. E poi comunque mi piacciono le partite perché ti danno una carica infinita. Infatti molte volte si pensa che un ragazzo in sedia a rotelle non possa avere delle passioni, non possa divertirsi, e invece è tutto al contrario e questo sport lo dimostra. Lo sport sotto questo punto di vista ti aiuta un sacco a livello psicologico, perché ti apre la mente e impari a socializzare sempre di più e quindi si crea un clima attorno che ti può tornare d'aiuto e nei momenti difficili ti dà una mano appunto a non mollare, ad andare avanti, e quindi credo che lo sport in generale sia un momento di svago e per aprire la mente.
Yes, sports and passion to open up your mind. Beautiful. Thank you very much for sharing, Jacopo. And as you might be aware, last week we had the Paralympics in Tokyo, and news has reached us that actually 2 men with Duchenne had made it to the podium. Not only the podium, they won a gold medal. We saw from the Czech Republic Adam Peska, who won a gold medal in Boccia. And just 2 days before, so officially the first Duchenne man to ever win a gold medal in the Paralympics was Philip Johnson from Sweden, who participated in shooting. So congratulations to both of them. And again, 2 wonderful examples of how you can still participate in in a lot of things in our society. For example, also in sports. Now, these stories come to us because part of the the Duchenne Social Project. And we're now also joined by Nicoletta Madia. Nicoletta, good afternoon.
Good afternoon.
You are the community coordinator of the World Duchenne Organization and also running the Social Duchenne Project. These videos are part of that, but let's start with the basis. What is this Social Duchenne Project? Also has its own website, socialduchenne.org. And what is the aim?
Well, the Social Duchenne program is focused on raising awareness of the importance of the impact of Duchenne muscular dystrophy in daily life. So what we do actually is to collect the direct experiences of people living with the disease, but also the families, so not only adults with Duchenne or boys with Duchenne. And beside this, improving the power of storytelling and how the storytelling can also be important for data collection to inform about the disease, we also have created a survey. With this survey, we have tried to analyze of course, the impact of the disease in daily life, and 30 countries participated. So we have a really important photograph about what is happening, what the needs are, and challenges, dreams coming from many countries of the world. So this is really important because care is extremely fundamental research too, but we have also to take into account the importance of the daily life with this disease for all.
Exactly. Beautiful project that really combines with the survey and the video interviews, really showing what it's like to live with this still rare disease. There's still a lot of people that don't know the disease, that need to become aware of it, hence this the Duchenne Awareness Day today, of course.
Exactly.
After doing all this work and talking to all these men, what are some of the first insights and findings that you can learn from this project?
Yeah, I would say that there is one word that is really important to collect all these insights. So the word I think that is access. Because what we have noticed actually is that they really always put the attention on access to education, access to employment, accessibility. This means, going outside with friends to eat somewhere or traveling without barriers. So when we think about the word access, this means that we think about access to a really full life, an inclusive life. So everyone, of the civil society really have to think about it, and we really have to work on including people with, of course, Duchenne muscular dystrophy, Becker muscular dystrophy, but all disabilities in general, because everyone deserves really a full life to be lived.
Exactly. So there's a task for all of us to open up our eyes, and instead of thinking, oh, you're so sad, I better take it easy on you, actually take them by the hand or by the wheelchair and make them part of the society.
Sure. Yeah, everyone, can easily do something for the other ones. So even with simple big actions. So today, for example, spreading, the word about this day, but every day in putting the attention on small things that can be really important for someone else. So this is, the goal that everyone has to have specific in his, her mind.
Exactly. Beautifully. And we can really learn this from listening to these first two videos we already saw. We have two more coming up. If people get excited and want to contribute to this specific part of Duchenne awareness, the Social Duchenne Project, what can they do to support you and the project?
Yeah, everyone can contact us actually, and we will continue collecting these stories and the importance of storytelling in informing about the disease, but also to change the things, to make a difference globally. So everyone can contact us on social media or by writing an email to us and proposing stories, ideas, because we will be happy to support it and to work it together.
Exactly. Work together and really bring them together in one place so
Exactly.
everyone across the globe can benefit from those collected stories.
Exactly.
Beautiful. Well, thank you for your beautiful work.
Thank you.
You are with us the entire afternoon, so I can imagine if you have any burning questions about the Social Duchenne Project, use that Q&A button, submit your question right now or promote the question of someone else. And then later at the end of the program, we also pose some of these audience questions for you, Nicoletta.
Thank you.
Thank you for being with us today. And I think it's very nice that we are all part of this and we all share. And we would love to see more of you sharing on hashtag WDAD2021. I look at Twitter, I see Deborah Robbins joining and sharing a picture of Ross, your talk actually. I see Annemiek Aatsma-Rus also active on Twitter and in the Q&A. Sarapita Therapeutics is with, well, Twitter is exploding. Let's see if we can become trending topic here today. So if you're in doubt, should I tweet or should I post something on Instagram? Let's do it. Hashtag WDAD2021. Let's move on to the next topic of our live talk show today. Yes, talking to the men with Duchenne themselves. Well, someone who's been doing that for a very, very long time is here at the table here today. Jos Hendriksen. Jos, good afternoon.
Thank you.
You are a clinical psychologist and neuropsychologist at Kempenhagen here in the Netherlands, but you're also part of many national and international research efforts. And last year we saw you here in this international broadcast also talking about the MIND initiative, the European-funded project about research for psychology in Duchenne and the brain. Now we want to zoom a little bit in on the psychosocial aspects of adult life with Duchenne. Before we watch an outtake of a beautiful documentary you've made about this, why is it important to look at this aspect today?
Well, actually, when we talk about adulthood, the main word for me is autonomy. And that's Old Greek for self-governance. And when you start thinking about that, you maybe can imagine why psychology is important in this. And there are three different forms of autonomy. It's about behavior, it's about emotion, and it's about cognition. And this helps to become independent in making choices, to be in control, to find possibilities to open your mind yourself. It has to be to do with the self, and that's what we try to explore in the video which we made and which was about a topic which we will discuss later.
Exactly. So we can already feel here at the table, if you talk about autonomy, about self, that's almost a very big contrast of being in a wheelchair, being fully dependent on a support network around you. So we can already see how becoming an adult and becoming autonomous can be, well, create interesting challenges, as you would say, Elizabeth. You referred to the documentary. This is something you created 10 years ago already. It's available on YouTube, over 40,000 views. Duchenne with a Future, The Power to Live. This is a full-hour documentary, and I recommend everyone after this live online broadcast, which of course will also be available in recording later as well. I saw some questions about that, to go watch that documentary as well. Jos, you have kind of selected a total of 7 minutes which really take the essence of what it means to be an adult with Duchenne. Let's have a look.
Each boy or man is unique, with his own strengths and weaknesses. They can live a normal, independent future and develop their own competencies, and with appropriate support can play a full part in society. This documentary is an effort to understand how young men with Duchenne cope with their illness and its consequences, how they manage stress and maintain a quality of life, about what parents can do and how professionals can contribute best. But above all, this documentary is about the key to successfully living an adult life with Duchenne. Meet Robin and Oliver from Belgium, Thomas, Peter, and Mohammed from the USA, Peter from Denmark, and Eustace from the Netherlands.
I like going to university, but maybe, it's not that everybody should do that. If you think, I just don't want to do that, yeah, it's also fine, but it's not that you shouldn't do it because you think, it's too hard or something like that, or too difficult to get it all organized. No. I think you should just try it.
Meet some people you can rely on and trust, otherwise trying to do it alone is somewhat tough,
Something is better than nothing. Being involved in some way is better than being left out.
Keep trying things, because, a lot of times you might think you're not capable of something, but if you try it, it's a good experience and you learn something.
Optimistic way of life is important, because if there's things you can't do, you have to focus on the things you can do.
Even in the face of difficulty, adversity, there is, great reason to live and love and enjoy the world and to have humor and joy. And those are available for everyone.
I think Duchenne men should be treated as adults, responsible for themselves, their care, for their own independence, and for their own productivity and happiness.
Too much is focused on that they're just handicapped children and not prepared for a future. And I think that's still happening in most centers in the world, where people already at the moment of diagnosis, they say, take him home and love him. Well, if people would have told my parents, don't expect anything from her at the age of 2 or 3, I would have had a different life.
When we measured the quality of life for the Duchenne adults, actually it was better than it was for the same group if you compared with the average group.
Ik heb eigenlijk een ongelooflijke bewondering voor de families die ik tot nu toe gekend heb. Want ik heb echt schitterende gezinnen gekend en mogen kennen. En ik ben dan ook echt heel dankbaar. Ik denk dat wij als professionelen leren nog dagelijks van de ouders en van de jonge mannen zelf hoe ermee om te gaan.
I think this is an extraordinary group of young men. And I have difficulty thinking about them without becoming emotional. They have taught me so much. And as a society, we need to do more for them. at every level of society. And the amount of resources that we have invested in them is minuscule compared to what we need to overcome. This is equivalent, if not even more difficult, than getting a man to the moon. And we need to invest those same type of resources for them. They deserve it.
Having Duchenne has a large impact on everyday living, but as shown, living an adult life with Duchenne is possible. Looking at these different stories from all over the world, we can sum up several success factors. Social and physical support leads to independence. Setting goals and reaching them in inventive ways. Daily activities give satisfaction, acceptance, coping, and optimism. Access to good medical and psychosocial information. Continuity of care during the transition to adulthood, all of which contribute in achieving a good quality of life.
I actually think I got a very good life with a lot of opportunities despite my disability. But my life is not perfect. I don't think you can find a life who is perfect.
I'm independent. I'm, happy, and I have, friends. I do what I want to do. I mean, I really don't feel that I'm held back.
It's the same things that anyone wants, and that I think is to be loved and to be with people you love.
If I have to make a grade, it would be an 8, I think.
I mean, I'd have to give it a 10.
I would say 10 now.
9 or 8.5 or something. Yeah, of course, you have moments that you think, that everything isn't that good, but that always goes away again, so.
I mean, I hate to say it because I would rather walk and all that, but at the same time, it's like, I feel like I value life a lot more than other people. A lot of other people just, sometimes I get angry too when I see people throwing away opportunities and chances, and I'm like, if you knew what life was worth. I mean, I guess the shorter time span makes you consider with higher value.
Je weet dat je kunt wel meer van dingen genieten. Gewoon dat kunnen kleine dingen zijn waar andere mensen gewoon niet naar kijken. Zo. Bijvoorbeeld mensen zien dansen. Ja, ik kan ervan genieten van dat gewoon te zien. Dat is heel raar.
Beautiful clip. Thank you so much, Jos, for making this together with Debbie and Jelle 10 years ago already. And if you missed it, the full 60-minute documentary is available on YouTube as well. You just have to Google for The Power to Live and Duchenne, and you'll find it. Jos, if we look at these 7 minutes, obviously we all here, I think, at the table write down some very powerful quotes. And you start to think, how would I rate my life? And would it be as high as we hear these boys do it? What, for you, is the main message of this video clip?
Yeah, actually, I think there are two main messages. There are a lot of them, but there are two main messages for today. And that's the first is that the men tell us that they have the power to live an autonomous life with Duchenne, within the choices they have in their physical possibilities. And this goes for young men who live independently, and also goes for young men who live in institutes, as we also saw. And they told us how they do that. And so one of the experts said, if we listen carefully, we can learn a lot of them. Actually, we have to learn a lot of them, because they tell us how they have to live their life, because that's a new generation, a new population. And the second message, therefore, is that experts and professionals have to learn a lot. And all the experts agreed that there is a lot to learn. That's why it's so important that we have this Awareness Day today.
Exactly. So both for men and their families, it is possible. And secondly, all professionals involved, like Ross Quinlivan was already telling us, need to really develop and learn this new area. We talk about dancing with Duchenne when they announced your contribution.
Yes. So when I was thinking about the theme for today, when I was preparing what I could tell, because we don't know so much about psychology and Duchenne, and actually I sit here as a psychologist, but there has to be a lot to be done. But when I thought about it, I was looking for a theme, and the theme which came up into my mind was what Robin said. He said, when I see people dancing, I can feel like dancing. And that's what psychology actually is about, that in your mind you can do everything. So dancing with adulthood, in my opinion, would be my main message for today, because this metaphor can help us to keep clearly the focus on what we should be doing in the next years with this topic.
Beautifully, dancing with adulthood. We found a beautiful visual to also really imprint that on our minds, to share on our social medias. Jos, let's explore this metaphor. Can you explain, how does dancing and living with Duchenne as an adult come together?
Yeah, when you start to think about it, this metaphor helps to be aware of the different issues which we came on the table today, because as was told, if you dance not synchronized, not in a coordinated way, the flow will not go, and it will not give you the pleasure and the enthusiasm which you need. So, but it should start with listening to the same music. So the social standards of care, the considerations which Professor Quinlivan talked about, everyone should listen to the same music. So it's important that we publish how the music is to be. So I think from psychological perspective, one of the challenges would be that we should start to write some of the guidelines for the making an autonomous life with Duchenne. Also, it's important when you start to dance, you should decide who is in the lead and who is to follow. And for instance, parents should learn and should be learned to take distance from the dance.
Which is very difficult.
That is, and parents.
Not only for parents with a child with Duchenne, but in general for parents.
Yes, but that is one of the main issues of teaching education your child, is taking distance, and that gives the child and the adult the opportunity to make his own choices. Okay. Independent decision making, self-governance. And so when it's not synchronized, there will be problems. It should be coordinated. Dancing should be fun because it opens your mind. And the more you dance, the easier it goes, and the better the results are, and the more fun you have.
You need to practice.
So you need to practice. So I would like that metaphor.
Beautiful. And to give you a little bit more authority on this, you're not only a very experienced researcher into the field of Duchenne, but in your private time you're also a vivid dancer, I learned. So you know what you're talking about. So can we color that in a little bit? What is typical if we look at dancing with adulthood in Duchenne? What are the typical things we run into?
From my perspective, so that's from psychological perspective, I think that the mental health issues are very important. And I see adult men in my clinic, in our clinic, and then I see that, for instance, it's difficult to find a psychotherapist who is willing and who is engaged and who is having the knowledge to start a psychotherapy. And I think that as it is common care and it is empirical care, which is available for everyone, but we should make it also available for the men with Duchenne. And Dr. Quinlivan talked about anxiety and depression, and there is one other important emotion, and that's one of the third emotion, and that's hostility. And those three go together. And they should be adequately diagnosed, and they should be treated adequately. And for that, I don't know any literature, and there has not been published any literature or research on this, but we need to do that because we need to make the shift to how do we do this for the man with Duchenne, because that's a different population. For instance, the combination of problems is some of the things which gives them maybe the most problems. For instance, when you see a boy who is having pain, they start treating the pain with medication for the pain. But if you look at the psychological part, there's also anxiety for the pain. And you can also treat the anxiety of the pain and then influence the pain itself. And that message is one of the messages which I experience we have to give, because that's important, because that's one of the things which we should recognize very well.
Very, very strong.
So the psychotherapy, I think there is a major gap, and there are psychotherapies have been investigated in neuromuscular disorders, and there is research on cognitive behavioral therapy, which is aimed at thinking, anxious thinking, to treat that. And there is also acceptance and commitment therapy, which is another psychotherapy stream, which is aimed at psychological flexibility. And I think that those are the two psychotherapies that need to be elaborated for the Duchenne.
Further applied, further researched, and further...
Yes.
Yes, exactly, clear. What else is important?
Now, there's another thing that is not so well used and not so well known in clinical practice, from my opinion, and that's the use of psychopharmaca, the use of medication to help them. As I told, we treat the pain with pain medication, but we could also treat the anxiety. And that you need a psychiatrist for that, because that is specialist work. And in our institute, we have some experience, but we need to do more on this, and we need to have some guidelines on this, because treatment of anxiety and of depression, psychopharmaca can help a lot and make the man more accessible for psychological interventions and for normal therapies, normalizing their life. And psychopharmaca can help in that respect.
So we hear you say there's different opportunities in different areas, but with everything you say, there's little evidence, there's a lot of research to be done. So let's wrap that up into practical, concrete advice for our audience here today. What can or what should we do, Jos?
There's a lot of work to do.
Exactly. First step.
So it's a good thing that the topic is on the Awareness Day. That's really very important. And I don't have ready-made answers, but we can think about guidelines on decisions to be made in living a life, an adult life with Duchenne, like I said about the autonomy. So the psychology of the adulthood in Duchenne is not yet researched, and we should write on it. We should start to do it. I'm willing to put my hands on it and to start to work on it. So we could start to elucidate what we can do in educating, in training. I think that empowerment is very, very important. We should make them and the parents powerful to open up their minds to their possibilities and to help them in self-governance.
Exactly. Really get to work all together. A lot of work to be done, empowering, and really learn to let go. Strong messages. I see already quite some questions coming in for the psychosocial part of adult life with Duchenne. If you have a question for Jos Hendriksen or any of the other guests at the table, please submit your question in the Q&A and help me and Elizabeth select which question we would like to take at the end of this show, where we do an audience Q&A and try to answer as many questions as we can by providing a thumbs up to you. For now, thank you very much, Jos Hendriksen, for your contribution, and I hope for to hear some more from you at the Q&A. Next up, we'll hear from another man with Duchenne about his life. I see in the Q&A that not only questions are being submitted, but people are also checking in. And we're truly collecting a global crowd from India, Algeria, Mexico, Argentina, Netherlands, Europe, all over the world. People are tuning in. And for the next interview that Nicoletta has made so well, we switch over to Brazil. We'll hear from Pedro Martinez, who is 33 years old and shares with us his ambitions of joining the workforce.
O meu nome é Pedro de Moraes Martins, eu tenho 33 anos e eu moro em Campo Grande, Mato Grosso do Sul, aqui no Brasil, e eu sou jornalista. Eu decidi que eu vou abrir um site sobre séries e cinema e vai ter um podcast. E além disso, eu escrevo poesia e prosa também. Eu já tenho 2 livros publicados e eu acabei de terminar outro agora na pandemia. Aí eu estou esperando, quando abrir o mundo, eu poder fazer o lançamento do meu livro novo. Eu acho que escrever você consegue tirar as coisas que estão na sua cabeça, tanto as coisas que te incomodam quanto as coisas que te deixam feliz, sabe? Então, sempre foi isso que me fascinou no jornalismo e na escrita. E a possibilidade da gente criar e inventar um mundo só nosso, né? Então era bem divertido. E eu tive a oportunidade de escrever sobre praticamente tudo que eu gosto. Eu já escrevi sobre esporte, eu já escrevi sobre música, eu já escrevi sobre... Eu escrevo agora sobre cinema e série. Eu encontrei muita dificuldade, assim, tanto que eu saí da faculdade e eu fiquei mais ou menos 8 anos sem emprego, porque para jornalismo mesmo, todos os lugares aqui, redações de jornal, de TV e de rádio, nenhuma tinha acessibilidade. Até que eu consegui um na Câmara Municipal dos Vereadores aqui de Campo Grande. E aí eu fiquei um tempão lá e era super bom, porque eu me sentia mais útil, assim, sabe? E podia socializar com pessoas diferentes do que eu convivia, né? É chato, não é bom nem saudável você ficar em casa sem fazer nada, sem ser útil para a sociedade. Então ter essa possibilidade de informar todo mundo seria de grande ajuda, porque a gente poderia ser mais incluído na sociedade e não sofrer tanta indiferença. Não é nem preconceito, é mais indiferença.
This quote from Pedro, it's boring and unhealthy to just sit at home. Now, I think whether you had Duchenne or not, I think we've all kind of had enough of sitting at home for the last 2 years. So it's time to move out. I think it becomes possible again. And then now let's all actually actively do that. It's time to take action. And in the next segment, we're going to talk to Habulani Magbela from Rare Disease International. Welcome, good afternoon.
Thank you. I'm really excited to be marking this day with you, so thank you.
Exactly. We're really glad you're here. Before I ask you more about the UN resolutions for rare, I'd like to know from you, Elizabeth, why is it important that with this Duchenne community, we try to become part of a bigger global movement?
Well, because a lot of subjects, like Pedro just said, we face, is not specific for Duchenne. It's for other rare diseases, also for different reasons sometimes, very difficult to participate fully in society. So we're stronger when we are together, right? So that is why we're very happy that Rare Disease International is joining forces to, well, I won't tell you a story, the story you will tell, to also call at the United Nations and say, everyone, leave no one behind, everyone needs to have access and participate and be included in society.
Exactly. So we're now shifting up a notch. We're not just making the world aware of Duchenne today, but actually for all rare diseases and accessibility. Thank you for being with us. You are the Strategic Engagement Manager for Rare Disease International, and then you're working on the UN, interesting, UN resolution for addressing the challenges of persons living with a rare disease and their families. Let's start at the basics. What is the aim and objective of this resolution for rare, and why is it aimed at the UN?
Yeah, well, we've been given this mission by our community, which involves our member organizations, including the World Duchenne Organization, and increasingly patients and families and their loved ones living with a rare disease, to really call on the United Nations to adopt a resolution that addresses the challenges of persons living with a rare disease and their families. This is not just a piece of paper that we're asking for to be signed at the UN, some sort of ivory tower, but it's really a powerful political resource. We want the states of the United Nations to recognize that there is a community of over 300 million persons out there living with a rare disease and their families, to make a commitment to addressing these challenges and the experiences of persons living with a rare disease. But also, it's a really practical document within the United Nations, because what it does is that it helps us unlock the budget of the United Nations to address rare diseases and the challenges of our patients and families living with a rare disease, and allows us to call on the agencies of the United Nations, whether it's the human rights agencies or around disabilities, around non-communicable diseases, to really start to talk and take action around rare diseases. I liked what Ross said about having this research that you can wave in front of your doctor. Well, this is a powerful political document that you can wave in front of your state, and that individuals, patient organizations, regional organizations can also wave in front of their government and say, you have made this commitment at the international level. It is not a resolution on rare diseases, so it's not about health, it's about so much more than health. Nicoletta mentioned the barriers that men living with Duchenne kept bringing up, the barriers to social participation, most importantly, to inclusion in their societies. So the first thing we're asking for around this resolution is really social justice and inclusion. It's about real participation in society and having countries and societies really think about integrating people living with a rare disease in a meaningful way in society. It says that when you live with a disease that very few other people have or know that much about, maybe including your doctor or the community around you, that it will have an impact on you, but also the whole society around you as well. So it's not just an impact on the patient, but also on society as a whole. So we're asking for care, but not just medical care, which is good, but also social care, which is also integrated into this picture. We're asking for countries to think about rare diseases, which sounds like very little, but is actually in many countries quite a lot. And we're asking to really be integrated within the UN system. And to do this, we need not only our members, but also the whole community of persons living with a rare disease to join the call.
Exactly, like we are today. Wow, very passionate and very clear explanation. You made it very clear why we address the UN, to actually then have it trickle down to our national and local communities, start global, shoot for the stars and end up on the moon. So we are working towards a resolution. Where are we on the journey? Is this work in progress? Is this an idea? Is this happening already? Tell us, where are we?
Well, I mean, this work has been happening for years. The rare disease community has increasingly become vocal within the United Nations, and mostly through the sharing of stories of persons living with rare diseases and their families. When we think about the Social Duchenne program, it is not just anecdotal, but it is a way of our community sharing what it means to live with a rare disease. And one of the main milestones that we've achieved in the UN is having rare diseases mentioned in the in the UN Declaration on Universal Health Coverage. But now we want to take it further. We're saying that rare diseases, yes, are about health, but really are about living in your society. So where we are in the timeline now is that we've had national organizations setting up calls and meetings with their national representatives and their authorities, and also having a social media campaign, so having our community be very active on social media and really raising awareness about the call for a UN resolution. But we've hit a stumbling block. And here we really need the whole community to really get involved and get behind us, or maybe even in front of us on this one. Because many countries are saying, we have no problem with rare diseases, but it is an issue for the World Health Organization and not for the whole United Nations. So what we need to show is that actually this issue speaks to the very heart of why the United Nations exists. It speaks to inclusion in education systems, transitioning to adulthood. We speak about dancing into adulthood. Well, that needs states to be reflective, to take action as well, right? It's not just a health response, it's a whole of society response. So what we have developed is a campaign that we're calling Dear UN, so very close to what the World Duchenne Organization is doing as well. And through this campaign, we're saying, what would you want the UN to know about what it means to live with a rare disease? And just share your short story. And through these short stories, we've had families talking to us about just getting a school for their child was such a mission when you live with a rare disease, that very often schools did not know what the needs of the child were, so were maybe unnecessarily intimidated by those needs, or were not adept to welcoming a child with a rare disease. And that has been, from kindergarten to university, the case for many families. Or transitioning to adulthood, we spoke to a woman from Kenya that told me, well, I always wanted to have my own house, but as soon as I tell the bank that I suffer from blood disease that they've never heard about, they don't know what you're talking about, and they're very frightened, so no one's going to give you a mortgage for this. So little things that most of us kind of take for granted about being part of your story in life are really some of the main challenges of what it means to live with a rare disease. So our mission, together with our community and the Dear UN campaign, is to really communicate this message that this is beyond health.
Exactly. Dear UN is kind of the tagline of the campaign. I understand from you we're working towards December of this year, 2021?
December of 2021. And the time really is now for a particular reason. And one of those reasons is because of the COVID crisis. First, it's shown that health issues are not discrete issues, right? That they involve all of society, and that vulnerable groups, such as people living with a rare disease, tend to be made even more vulnerable when there is a health emergency. And vulnerable, yes, from a health perspective, but also from an emotional perspective, a social perspective. So really, this is a time when almost the UN is more sensitive towards issues connected to health. So we're saying, let's have a clear date in mind, and let's make it December 2021 for our community.
Right, so even more time for action, especially if this passion here flies over the table. What can we do? How can people watching and participating now contribute to this resolution for rare?
Well, the thing is, everyone can contribute. I think, especially as a younger person, what I can say is that social media has meant that everyone has a democratic voice. So we've created a social media toolkit that we encourage people to download from either the RDI website or even the Duchenne World Organization's website. And there you can go on Instagram and just share that this is what the rare disease community is trying to achieve. Also help educate others about what a UN resolution actually means for us. And you're also welcome to go, whether it's through the World Duchenne Organization or through RDI, to share your story, to write to the UN, and really try to help policymakers understand what it means to live with a rare disease.
Beautiful. Well, thank you so much for your hard work and coming here to share that with us and really make us part of this bigger global movement towards the UN. Very passionate, and you also stay with us to answer any questions. So if you have any questions about the resolution for rare, about the materials, or about the story that Hlabulani Magbela just shared with us, please send them into the Q&A box right now, or give it a thumbs up if you would like to promote a question. We're almost coming to that part of the program, but we have two more important steps to take. First of all, I'll zoom in a little bit more with Elizabeth Vroom on how patient organizations can even take more action. But before we even do that, we want to share one more of these stories, these beautiful interviews that Nicoletta Madija has made specifically for this World Duchenne Awareness Day. She talked to the United States with Adit Tumalapalli, who is now 23 years old, and shares with us what it's like to live with Duchenne as an adult man.
My name is Adit Tumalapalli. I'm 23 years old. Living with Duchenne muscular dystrophy. I am from the United States, and currently I'm a technical solutions engineer. Originally, I'm from Maryland, which is on the east coast of the United States, and Wisconsin, where I live right now, is about a 14-hour drive away. So going so far away for work is difficult for most people, whether you're able-bodied or have a disability. But it's even harder for people like us who have disabilities, especially muscular dystrophy. Living far away from home has its own set of challenges. But I was able to overcome those challenges in college with the support of my parents. Things like hiring a caregiver, things like paying for the caregiver, being able to live on my own. Those are things that I was able to handle in college. So transitioning to this job had similar challenges. I had other things to consider, like finding an accessible apartment, setting up insurance, a new care team in a city that I had never been to. And currently I'm still working through some of those challenges. I'm very excited to be able to try this. I'm still young now, and now is the time when I think many people want to try being independent. I want to give it a try. And, if things don't work out, things don't work out. It's as simple as that. I can't sit here and worry about things I can't control. So I think it's just realizing I can only control what's in my power. I can only do my best. Independence for me means not having to rely on people for the things that I can do myself. Now, of course, as somebody with a disability, I need to rely on somebody to help me, get up in the morning, to help me get in the shower, to help me dress, to help me, I use a power wheelchair, so to help me get in my chair every day. I sleep with a BiPAP machine, so to help put all of that stuff on. Of course, these are things I need help with and will always need help with. But for me, independence is more than that. It's about being able to do things like handle my own finances, being able to be self-sufficient, to, make the money I need to support my needs, and to even go beyond that, to be content with life. I think it's important to sort of live in the moment. We don't know what tomorrow brings, and I definitely try to live in the moment and enjoy life as it is as much as possible, the good parts and the bad parts. My lifelong dream or my lifelong goal is honestly just to help people however I can.
Thank you so much for sharing, Adit, a lifelong goal of helping people. Well, I guess that is why you are here joining us live or watching this recording right now. And you must realize you're part of a smaller elite group that took the effort to actually join us here today on World Duchenne Awareness Day. So you would need, or ideally, become an ambassador of the knowledge and the messages that are being shared here today. And before we go to our Q&A and try to answer as many of your questions that you have submitted, I'd like to zoom in on that a little bit with you, Elizabeth Vroom, Chair of the World Duchenne Organization, specifically on the work of patient organizations across the globe. You're very active on that yourself here in the Netherlands and internationally. What are some of the things that you would like people to start doing as of today?
Well, to be honest, one of the things is that we might start to change the name of our organizations. Like in the Netherlands, we call Duchenne Parent Project. Well, that is still this kind of top-down parents in the lead. And we could and should give a bigger role to the man themselves with all their wisdom and all their experience. And they are the experts, in fact. And of course, there are, we will speak about that later, also patient organization which started by the young man, which is even, I think, a stronger movement. But I think so. First of all, we have to get used to the idea that we as parents are not the best to know, but it's the man. Mm-hmm. That is one. The other is, I think we can wave to as you can wave to the clinicians, we also, to networks of clinicians in your country, you can wave like, this is really important. But it's also about the organization of the care, you know, and e-health is available now. And we had a meeting about that ages ago already. Why do patients always have to come to the doctor? You know, why are the doctors not going and seeing the patients at home? Or if it's not a clinician, it might be a specialized nurse, just to see how they live, what are their challenges, how the situation looks like. An individual patient can't do that, but a patient organization can push to do it.
Can really advocate for that.
Yes, so in a medical field we can advocate. I think also there is in Duchenne a kind of weird balance. On one hand, like Adi just said, you know, living in the day is considered a strength of Duchenne parents. But next to that, you also should plan for the future. So only being happy today is not enough, where you really have to plan and prepare your child for an adult life. So there you have to live in two tracks, let's say. And the same holds true. I see all questions here for people who want to cure. And of course, everybody wants to cure. But I think the real challenge for families, and patient organizations should help there, is that you have to live on two tracks, in fact. One track is that we all want a cure. One day we want to kick out Duchenne. And the other track is without a cure or with treatments that slow down but still don't prevent Duchenne from happening. We still have to find the optimal way to live that life and to prepare your children for that. So you have to do both. It is a challenge. And we have to get rid of the idea that we as our parents are the best caregivers. We are not. I remember when
Ouch.
No. But when I remember that I thought like, oh, if my son if he won't have friends, then I'm going to be his best friend. Of course I'm not. I'm his mother, you know. I'm his mother. And of course you can help out, but you're not the best for everything. You're not. Wow. So accepting that already might help to have helpers more their own age and so on. So I think that is an important one. And then I see here already questions from like Annemiek and so on saying like, yes, but what to listening to patients? We all should listen to them. And that's also the message patient organizations should take for themselves, but also give to clinicians. I've seen so many examples where patients themselves told, I think it's, and I'm sure you have seen that, I think this and this is causing that and that. And it's like, no. Just because you've never seen it. But just listening to the man and really listening to them, and then only start research and questionnaires, whatever you want to do, based on what they say is important. So now we have a short interview with
there's a beautiful example of this, exactly what you say, right? Putting patients at the heart of research and the patient organizations. Before we watch Suzanne explain, anything we need to know? This is about the Pathfinders?
Yes, Suzanne is working since a year. She is has SMA herself, so not Duchenne, but she's very much involved with Pathfinders. And they set up a research project where really the men are at the core. They are also co-authors, but that's also very funny. If you look in the project where there is input from patients, they are hardly the authors, you know? So that already gives the idea how you should twist the idea. They are the experts, so why are they not authors, right? So Pathfinders is set up by John Hastie, who's on holidays today. Otherwise, we could also have asked him some questions because it's an amazing job he did. He also prepared a beautiful documentary. He traveled in Europe to visit men with Duchenne and interview them. And I think they are really active in having, last year we showed their nutritional guide, which they prepared. This year they have been part of your work as well on the guidelines. So I would really say, look at them as an example, which doesn't mean that you have to do it this way, but I think it's a wonderful example, and I think Suzanne has to share a nice story.
Exactly. Let's hear from Suzanne Glover about the Pathfinders Alliance.
My name is Suzanne, and I'm 29 years old, and I'm from Northern Ireland. I have spinal muscular atrophy type 2. In March last year, I completed my PhD in Ulster University, and since then I have been working for Pathfinders Neuromuscular Alliance as a research officer. Pathfinders Neuromuscular Alliance was co-founded by John Ray Hastie, who has Duchenne muscular dystrophy. The organisation is ran by and for people with neuromuscular conditions. They campaign to improve services and the lives of people with Duchenne and other neuromuscular conditions. Pathfinders provides a hub or a central way for people with neuromuscular conditions to connect and support each other, provide advice and friendship, really, from across all of the UK and even wider than the UK. Pathfinders are currently doing a research project on transition to adulthood for young men living with Duchenne. So the idea is to look at some of the issues around becoming an adult that are very personal to young people. One of our topics is looking at the development of identity and how young people perceive their identity as a teenager and how it changes as they become an adult, and in what ways having Duchenne influences these changes. We're looking at things like goals to becoming independent and what being independent actually means. What is the meaning of being independent, especially in the context of a condition that causes more and more dependence on others for assistance. We're looking at how people perceive their relationships when they are moving from being a young person to an adult, their close relationships and how they feel connected to other people with disabilities and Duchenne, and maybe how they feel connected to people without disabilities, and is there a difference there? So really, in summary, we're just looking at how young people with Duchenne see themselves and see the world around them. as they grow older. I think what's really important about this research is that it is a peer-led initiative. And so that means that all of the research is driven and carried out by young people with Duchenne and neuromuscular conditions.
Yes, beautiful project, beautiful example, Elizabeth, of really putting patients at the center, not only of their care, of their network, but actually at their scientific research about the development of the disease. So what can we learn from that, taking that forward?
Well, I think this is a wonderful example, just really starting. I mean, my son is an industrial designer, and there you always start with the user. That's not more than normal that you start from the user's wishes and then build up. In medicine, that's not. But it's not only about medicine, it's also about how to... I remember I spoke to Suzanne, and she said, we do everything online because if I would have to travel, we could have never done this. And I think also patient organizations, we see, if we say that the world has to be accessible and you organize a conference where people have to fly in, who can fly in with 2 helpers, and maybe 3, with all your things and so on? That's only, let's say, the happy few. So if we want to include everybody, we also have to think more about accessibility of our activities. So in the coming years, so we will have this 6 months of adult life with Duchenne before we start a new subject. And we will have, as the World Duchenne Organization, we will organize several webinars on subjects which are very specific, related to adult life, whether it's medical issues like the gastrointestinal problems, but also like we get questions about becoming a father with Duchenne. What are the challenges? What is known about that? What are the experiences? So I'm not going to mention them all. We will have a whole series. But it should be, what we do should not be for the people who can go to a conference. It really should be for everyone. And I think last but not least, there's a call for money, more money for care, but also to spend our money as patient organization. Again, if you see the question, it's always about clinical trials and so on. Companies can pay that. We don't have to do that as patient organization. As patient organization, we can make sure that there's more research to look into things like what is the best treatment for adults with Duchenne and so on. That is really something that typically fits our core of the organization. So with that, I think we can go to the questions.
Well, you've been looking at the Q&A a lot already. Thank you for really underlining the powerful work, and thank you personally also for the enormous effort that you make in this worldwide Duchenne community, and now taking along all these patient organizations and inspiring them of all the work they can and should do. Thank you, Elizabeth.
We do that together.
Yes, but you're an important face of that. With that, as Elizabeth has announced, it's time for the attempt to answer as many of the questions that you have submitted. It's time for interactive Q&A. Yes, so how this is going to work for the next remaining 20 minutes of this hour is that we are going to look at that Q&A box. I see many questions are already answered, written by our team behind the scenes. I also noticed some of you are having some technical issues with the live Spanish interpretation. We're very sorry for that. We're working on a technical solution. And if somehow you really get lost in the English that we use here at the table, be aware that the recordings of this live interactive talk show will also be made available with Spanish interpretation on top of it. So, you can actually help and influence what's going on here in the studio. We still have all our experts with us around, and by providing us thumbs up, you can then select which questions we would like to go first. Elizabeth, I also invite you to kind of help me and make sure we have some nice questions for everyone. But I think it's only fair to start with the top-rated question at the moment. 9 people would have voted up the question of Mandy Hanna, joining us live from Australia. Thank you, Mandy, and I guess a proper good evening for you. Thank you for joining us. The question, and I think, Ross, it might be directed to you, or you're the best one helping us out with this, is my question is around whether there is a discussion about being proactive with early surgical interventions when people with Duchenne muscular dystrophy are younger and healthier and able to cope with anesthetic, because you already explained that anesthetic becomes more and more complicated, people are not aware. Any discussion or work being proactive on a surgical side? What is your knowledge about that?
Well, I guess one always has to weigh up the benefits against the risks. So I think the example that you might think about would be a feeding tube, a gastrostomy tube. And if you leave that till the person has lost a lot of weight and is very underweight, then the risk is much higher. At the same time, if somebody is maintaining their weight, then you wouldn't want to put them under an anaesthetic. So that goes back to my point about people having their weight measured on a regular basis. And then when we start to see a trend, then you would start to have those discussions before it reaches a crisis point. So I think, it's a really good question. And I think, that is the way we would balance those benefits against any potential risks of anaesthetics.
It's a tricky balance, and the monitoring comes in to actually get the timing right.
Absolutely.
Thank you. Thank you for answering. And thank you, Mandy, for that question. Now, all the others voting that up. And then Sandy Curvin is writing, thank you, Mandy. And if you find the answer, please share with us. So that's happening as well. Next runner-up with the most thumbs up is a question that came in early from Annemiek Aartsma-Rus. I think you already referred to it, Elizabeth. She's writing, how can we make sure that we also learn, for example, the adults with Duchenne who found a solution to cope with a specific issue? Maybe I want to look around to you, Nicolette Medea. You're interviewing a lot of them. Maybe people who tune in later. Do you have an answer for Annemiek? How can we share all the great insights that you discover?
Well, from a general communication point of view, it's important to follow this kind of initiative that we organize and also all the project, the educational project that we run, because there you can find a lot of information about direct experiences of our community and how maybe they cope with some specific things, which solution they found. And it's also interesting because the adults with Duchenne can also share between them the direct experiences, creating one important thing that is the group. So a discussion group, this is extremely important and helpful also for the families, for the parents. On the other side, it's also important to collect specific data on this. So with this report that we will publish by the end of the year on our Social Duchenne program, you will have this really clear picture about needs, challenges, and solutions. And of course, we have to work, as I said, all together to find specific solutions for problems that are not so huge, and everyone can help in solving those.
Exactly. Well, thank you for sharing. So it all comes down again to sharing, connecting. If you don't ask, you never know, like it is in this live Q&A right now. And let me remind you, I've been reminding you about the hashtag of today, hashtag WDAD 2021. If you're not such an avid social media user, you might think, why would I need that? Well, one of the things you can do is go on Twitter or go on Instagram, search for that specific tag, and you'll see a ton of international folks and accounts who currently are being active around World Duchenne Awareness Day. If you follow them, if you connect with them, this is another way to really connect globally and then use that network to exchange tips, solutions, research, calls, anything we like. So that's an extra tip you get out of this. Elizabeth, if you're looking through our list of Q&As, is there a specific question you would like to take out?
Well, that's a question which also scored high, and I would kind of give that to Jos, and that is from Indonesia, saying how to keep the child's mental with his condition later and can live more years and happy always. What a world movement in educating the patient's parents. So the last part, I can say, yes, that's what we can do, but the first part, I think, Jos, is... so the question is, as I understood, and I hope I do well, Anita, like how to keep the child happy with their condition later. Although we have seen that they are not so unhappy as we anticipate, right, with the adults. But I think you're the best.
Any off-the-cuff tips that you can share with our audience here today, Jos?
I have a very easy tip, because if you listen to the interviews and if you listen to the man who's giving us some messages about accessibility, about making your mind open to. So I think when we listen to the interviews from today, there are a lot of lessons to be learned to live a good life and make that a success.
So again, you say back to Nicoletta's social Duchenne project, dive into the stories, connect with people around the world.
Yeah, and then, but I think we should take care that there will not be a pool with a lot of information where you can drown, as for instance you could say. So maybe there would be some opportunity to make some information more or easy accessible, but we have to listen to the men themselves to learn it.
Exactly. Beautiful message, and thanks for the question, Anita, and thanks for joining us live from Indonesia today. Should we take the next one? 5 thumbs up. I see Scholar Mutamia, from Kenya. You're referring that to as well. But let me see. Yes, it's kind of a long case description, but the question is all the way at the end, and that is, again, about networking, connecting across the globe. Can we have partners from the World Duchenne Organization and global research institutions or hospitals that we can connect on this? Because they write about their experience going to a hospital. They are not familiar with the disease. So this is not even in politics, like you refer to, but even at the hospital, they don't know what you're talking about.
Yeah. So one of the questions is, can we have partners from the World Duchenne Organization? I think we have discussed before, and having good information. So these parents now, patients can come in and wave with the information, which is often not enough. We also have been discussing in the past more and more, and sometimes that's happening, kind of having a mentoring program. So you connect a hospital. You can't do that for every individual patient, but you can connect a hospital, like now in Kenya, maybe to a hospital where they have a lot of information for Duchenne. The matter is then that you have to organize it well, so it's not kind of floating in all directions. But if you have specific questions, I remember that for the diagnosis of Duchenne, for example, labs from the Netherlands were doing the analysis, and not only from the Netherlands, also from France has been very active, from countries where they couldn't do it themselves, the DNA testing, and they would do it in other countries. So in that sense, but it's difficult to organize it, and arrogance is always a problem. I mean, we see in all countries, also in Western countries, if it's not invented here, it can't be that good. And that is a major issue we face. So that is,
Yeah, Ros, I hear you nodding. You talked about the network that you initiated and how you come together. How did you overcome some of these not invented here challenges?
But I think this is exactly why we developed that network, was to put people in touch with each other and hear different people's views. And I think that's one thing that different countries can do, is create their own networks and pull people together. And going back to the other point is you learn from the people with the condition themselves. They teach us so much, and so it's really important that they're included within those networks.
Exactly. Not talk about them, but talk with them and really include them in everything. Lawilane, you are very powerful with Rare Disease International in bringing together people and cooperations. Any additional tips from your side? How do you break these boundaries? How do you break protectionism or not invented here syndromes?
I think the best thing to do is always to get together, to network. One of the things that RDI is working on with the WHO is really creating networks for rare diseases that start at the patient level. So very conscious about empowering patients at those networks so that they don't find themselves being at at the bottom of the structure at more medical networks. Just using Kenya as a good example, the organization there began as a mothers group on WhatsApp and is now a strong national alliance that is able to communicate with health experts, with researchers, and set a dialogue around rare diseases within that country. So I think the best step is really not only to find networks within a particular disease area, but within rare disease as a whole, within your country, and then also look regionally and internationally.
And I think I start to hear an echo here about putting the patients at the heart of everything we do, which, of course, is a transition in this community, which is new because it used to be mainly boys with Duchenne, and boys are helped by their parents. And like you already said, Elizabeth, now they become men and adults and people who should be part of this community as well. I look at the clock and I think we can take a few more. But which one would we select? We can be 100% democratic, or is there anything you want to pick out, Elizabeth? It's my co-host.
Well, maybe there's one, as Ross comes from the UK, there's a question about drinking alcohol. And in Amsterdam, we always see the bachelor's parties coming from the UK, so no. But I think that's the question you get as well, right?
Yeah, sure.
The question is from Tanja van Houwelingen.
Yeah,
drinking alcohol is part of adult life.
Yeah,
Are we aware of any risks? Typical parent question, by the way. You should not drink alcohol.
Yeah, no, for sure. But I think it's a really important question, isn't it? Because it's about living a normal life, being normal. And what would any parent say to their child is, don't do things to excess. A little is okay, but in excess, it's bad for you. And so I certainly wouldn't say to people with Duchenne that you must not have I don't think you can say to anybody you must not have anything, but be sensible. Remember to keep yourself healthy and don't do things to excess, because that's where problems occur for any of us.
And if we flip that coin, because this is the proper answer, but are you aware of any research or any specific risks?
Not research, but certainly experience with some of the young people that I've seen who have taken too much and become seriously unwell, on a single occasion. Going to parties and things. So we've seen that several times. And we've also seen people running into problems when they take recreational drugs to excess as well. So it affects all populations of people, whether they've got whether they're healthy or whether they've got a rare condition, people are the same. And so I would just say to people, be sensible.
Nice. When we say we need to listen to the men themselves, let's take our last question, or one of our last questions, from Wasim Qureshi. Yeah. I hope I pronounced it nicely. He is joining us live from India, saying, hello, everyone. Thank you for this knowledgeable session. I am Wasim, 29 years old, Duchenne muscular dystrophy warrior from Mumbai, joining us live. And he's asking, I think this one is directed to Jos, what kind of practices should we follow on a daily basis for our mental and physical well-being? Well, and physical, he says, but let's start with Jos. Daily practices, any nice tips?
Daily practice is that you take your daily mental rest to get energy for all the advantages and the challenges of the day. And you could say they should learn to have their pauses every day, some moments to reset the system and to tune off and to get energy for the stresses that are part of adult life and normal life.
And when you say rest, is that literally like a 30-minute nap? Or?
No, it can be, for instance, mindfulness and relaxation therapy are very important. And that's one of the things with which we are doing some research, that when you do that daily, several times on a day at random, it helps you to make your mind clear and to be able to function psychologically in a well-balanced way to dance into adulthood.
There it is again, dancing with adulthood. And so what I learned from you is it's okay to acknowledge that life is maybe a little bit more stressful if you're challenged in a physical way, like with Duchenne, and allow yourself for the rest to recharge.
Yeah, but it is stressful for everyone.
It's stressful for everyone,
and you can learn, and you have to find the ways to get into control. And that's what I heard, and that's what all the men told. Find the ways to get into control, and that can be very easy ways. It's no abracadabra.
Well, thank you very much, Wasim, for your question, and Jos for your answer. With that, we near the end of this interactive live talk show on adult life with Duchenne. I see there's plenty more questions here in the Q&A, so don't worry. These questions are actually great input for the further future content that is being developed. Elizabeth, you already referred to it. There's a webinar series coming out for the next 6 months. Each month there will be a webinar on the theme of adult life with Duchenne, and then working towards the grande finale of the Duchenne Care Conference 2022, which is all about adult care and Duchenne muscular dystrophy as well.
In April, yes.
In April of this year. Finally, yeah, true, next year. Coming year, next 6 months. As kind of a concluding reflection, which takeaway message would you really like to underline for our audience here today?
I think our audience here today, that will be very mixed, is also to have more almost trust in the men themselves. And the boys, don't overprotect them. Like normal children, something might happen or not, but just kind of to also believe that they know what's best for them, which sometimes might not be the case, but many times they do. So I think that would be for me the key message. And then act on that, what they say and what you learn from that. I think that is important. And to facilitate that all the things we discussed around the table today, we have to facilitate. People have, and if everybody is doing a little thing, together we can make a huge move for the adult man. So that would be my take.
Beautiful.
Trust them.
Trust,
let's
make an effort. Everybody doing a little thing. Let me remind you for the last time today, it is Tuesday, September 7th, or if you're watching this as a recording, you can still do this. Please go online, use the power of your fingers and your mobile devices at your disposal. Shoot a photo of how and where you're watching this, or another capturing picture of how you envision adult life with Duchenne, and share that with hashtag WDAD2021, World Duchenne Awareness Day 2021, to really make this wave happen, to allow others to connect with you, to follow with you, and to grow our networks where we really put these men with Duchenne at the center of the patient organizations, of the research, of the medical care, of the psychological care, of the advocacy, and of the great stories. And with that, I've pointed at all our guests today, but I'm also really explicitly going to thank you. We kicked off with Professor Ros Quinlivan. Thank you very much for joining us today.
Thank you. It's been a pleasure.
Nicoletta Madia, thank you and congratulations on the great video and the great work with the Social Duchenne Project.
Thank you.
Jos Hendriksen, thank you for all your tips and insights and the beautiful metaphor of dancing with adulthood in Duchenne. I think that is an image, a powerful image that we're going to remember. Also, Habulani Macabela, from Rare Disease International. Thank you for your very passionate advocacy here to make us part of this global movement for people with disabilities and their accessibilities at the UN. It's not about health, it's about society as a whole. And of course, finally, Elizabeth Vroom, it was a great honor and pleasure to be at your side here today. Few people to mention, can't forget, Aylon Golan, Jacopo Verardo, Pedro Martinez and Adit Tumalapalli for their great stories to share with us. They'll be available online as well. And and of course, Suzanne Glover, not to forget. Behind the scenes, we had Justus Keijer once again creating all these great graphics and visuals for this live broadcast here today. And Suzanne Bakker doing all the preparations, the communications, the live chat and everything together with the team of Engage TV. It was a great honor and pleasure to be your host here today. We look forward to all your craziness online and social media, and we hope we really make a dent together and really make this global community aware of Duchenne and the opportunities for all people with disabilities in general. With that, we come to the ending of this year's live online talk show on Adult Life with Duchenne.